The nose has two functions. It acts as a respiratory passage and it is the organ for smell. The upper one-third of the nose is covered by the olfactory mucosa and the rest is covered by the respiratory mucosa. It also acts as a respiratory air conditioner. The nose is classified into the external nose and the nasal cavity. In the external nose, it is made up of the nasal bone, the frontal process of the maxillae, and the nasal part of the frontal bone. All these form the bony part. The cartilaginous part includes the superior, the inferior, the septal, the greater, and the lesser alar cartilage. Let's see this diagram. So this is the root, the bridge, the dorsum nasi, the apex, the nasal septum, philtrum, ala nasi, alar nasal sulcus, and the nasofacial angle. Blood supply of the nose is done by the ophthalmic, the maxillary artery, and the facial artery. The nerve supply of the nose is done by the infratrochlear nerve, the external nasal nerve, and the infraorbital nerve. The nasal cavity of the nose. This usually comes as a short note. So the nasal cavity of the nose comprises of the floor. So this is the palatine process of maxilla, the horizontal plate of the palatine bone. Secondly, we have the roof. The roof includes the sphenoid bone posteriorly, the frontal bone and the nasal bone anteriorly, and the cribriform plate of the ethmoid bone in the middle. The middle wall of the nose. The nasal septum divides it into two equal halves, that is, the osseous part and the cartilaginous part. It is made up of the perpendicular bone, the vomer, and the septal cartilage. The lateral wall of the nose is a frequently asked short note. The lateral wall has three projections: the superior concha, the middle concha, and the inferior concha. The cuticular lower part is formed by the fibrofatty tissue covered by skin. Concha. The superior and the middle concha arises from the labyrinth of the ethmoidal bone. The inferior concha is independent. The space below each concha is called the meatus. The inferior meatus has an opening for the nasolacrimal duct, the middle meatus for the frontal air sinus, maxillary air sinus, and the anterior ethmoidal sinus, the superior meatus for the posterior ethmoidal sinus, and the sphenoethmoid recess for the sphenoidal air sinus. The sphenoethmoid recess is a fossa above the superior concha. Now let's see the formation. In the formation, we have the bony part and the cartilaginous part. First, let's see the bony part. So we have the nasal bone, we have the frontal process of the maxilla, the lacrimal, the labyrinth of the ethmoidal bone. Then the fifth one is the inferior nasal concha. Then we have the perpendicular plate of the palatine bone. The seventh one is the medial pterygoid plate. Now the cartilaginous part. The first one is the superior nasal cartilage. The second one is the inferior nasal cartilage. And the third one is the 3 to 4 alar cartilage. So the 8th, 9th and the 10th part, this comes under the cartilaginous part. Paranasal sinuses. The paranasal sinuses are air cavities found in the frontal, the maxillary, ethmoidal and the sphenoidal bones. So this is the frontal sinus, the ethmoidal sinus, sphenoidal and the maxillary sinus. Functions of the paranasal sinuses. It helps in warming up and humidifying the inspired air, therefore reduces the skull weight. It is covered with periosteum. The sinuses are absent at birth and they enlarge rapidly during 6 to 8 years. The growth of the sinus is in children due to enlargement of bone and in old age due to resorption of bone. The first one is the frontal sinus. It lies in the frontal bone. It is not symmetrical and roughly triangular in shape. It extends from the medial eyebrows to the roof of the orbit. It opens into the middle meatus. Arterial supply is by the supraorbital artery. Lymphatic drainage is in the submandibular lymph nodes. Then we have the maxillary sinus. It lies in the maxillary bone. It is paired, symmetrical and pyramidal in shape. The roof is formed by the floor of the orbit and the floor is formed by the molars and the premolars. It opens into the middle meatus. The size of the maxillary sinus is reduced above by the lacrimal and the ethmoidal bone, below by the inferior nasal concha, and behind by the perpendicular plate of palatine. The arterial supply is by the facial artery. Lymphatic drainage is in the submandibular lymph nodes. It is related superiorly to the optic chiasma, below to the roof of pharynx, and on the sides to the cavernous sinus. The arterial supply is by the posterior ethmoidal artery. Lymphatic drainage is in the retropharyngeal lymph nodes. Then we have the ethmoidal sinus. It is contained in the ethmoidal bone between the nose and the orbit. It is divided into anterior, middle and posterior. It drains anteriorly into the hiatus semilunaris of the nose. The middle portion drains into the middle meatus of the nose and posteriorly drains into the superior meatus of the nose. Clinical anatomy. Sinusitis is infection of the sinus. It causes headache and thick discharge from the nose. Pain in the maxillary sinus is referred to the upper teeth. Pain in the ethmoidal sinus is referred to the forehead. Hypertrophy of mucosa above the inferior nasal concha leads to sneezing, nasal blockage, watery discharge from the nose. Anosmia is loss of olfactory fibers with aging. Allergic rhinitis causes temporary olfactory impairment. Fracture of the cribriform plate results in dripping of the CSF. Common cold is caused due to infection of the nose, for example, during seasonal changes.